So that's a very complicated, it's a great question with a complicated answer. So to understand what type of surgery is right for you, that's why you meet with your surgeon. So we don't do minimally invasive surgery on everyone. We make sure that you're an appropriate surgical candidate. So we do that through a few ways. One is we take a history. We understand about your other medical problems, the other surgeries that you've had. It's very important to us, and some of the other disease conditions that you have can really bear an impact on what type of surgery that we would suggest or recommend for you. Additionally, we perform a physical examination. So the importance of that is that there are certain conditions that would exclude you from that. And so we examine you for that, and finally we take x-rays. There are certain things on x-ray that we can see, such as arthritis or other deformities of the foot or ankle that could make you not a candidate for that surgery or an excellent candidate for that surgery. So that's one of my roles. I kind of jokingly say that I treat patients, not x-rays. So it's my job to help incorporate your history, your physical examination, and your x-ray together, and then also what your specific needs are to determine what the right surgical treatment is for you. Yes, it does. So because this is a condition that you didn't do anything about, we make sure your insurance covers it. They pretty much all cover this problem, and that's something that we take responsibility for. So we ultimately will not kind of finalize your date on the surgical schedule until we make sure that your insurance approves this. So the question about how long to be out of work is really variable. So often with this, we tell you what you can't do, and then sometimes it's a matter of the type of job you have, how much your employer will work with you. So there's some factors like that. And some of it matters if you have your left foot surgery or right foot surgery too. People may not think about that, but obviously if you can't drive, that's a pretty big deal for trying to be able to get to work. So most commonly after this surgery, we don't let you put any weight on the foot for 2 weeks. The reason for that is we want the surgical incisions to heal well and decrease the chance of infection or wound healing complications. At 2 weeks, we'll let you start to put weight on it. And what's important is there's a difference between me starting to let you put weight on it and you actually being able to put full weight on it. Most folks we allow to start to put weight on it at 2 weeks. Most folks are putting full weight on it without needing any assistive devices like a cane or crutch or walker or knee scooter at about the 3 to 4 week mark. So it's a little bit variable. Often we'll let you go back to sedentary duties at work as soon as maybe a week after surgery. As long as you're off any strong pain medicine, you can have somebody drive you to work, or maybe you can work from home and we'll let you get back to work about a week later. If you have a very demanding job with a lot of walking, or your work won't accommodate you and say, hey listen, you're either no time or full time, then often before people ever get back to full-time work doing heavy duty labor like landscaper or something like that, maybe 6 to 8 weeks. It's a little bit variable from person to person. But I would say most folks are able to return their job 3 to 4 weeks later, some as early as a week, depending on the type of job you do.